Good evening, everyone. Welcome to our discussion on teen mental health, suicide prevention, and bullying. My name is Jonathan Chung, and I'm the Director of Public Policy here at the National Alliance on Mental Illness of New York City, and I'm moderating tonight's discussion. We're glad that you're all here for this really important conversation. The topics being discussed aren't necessarily the easiest things one wants to address, but bullying is a risk factor for suicide and can have long-term effects on mental health. We need our community members to feel more comfortable and confident spotting warning signs, knowing about resources, and understanding our youth to best support them in a time where there are so many pressures and challenges that are really tough to face. We are joined this evening by two of my NAMI-NYC colleagues, Patty Billings, our Community Education Coordinator, and Chloe Bound, our Peer Support Groups Coordinator. We are also joined by Dr. Derek Matthews, Director of Research Science at the Trevor Project, and Tommy Marzella, VP of Social Platform Development and Safety at the Trevor Project. We were also going to be joined tonight by Casey Starr, who is the Co-Executive Director of the Samaritans of New York, but she is unable to join us this evening due to some last-minute circumstances, but we will be able to share some resources from the Samaritans towards the end for anyone who may need that. And last, but certainly not least, we are honored to have New York State Senator Brad Hoylman-Sigal join us. Senator Hoylman-Sigal represents New York's 47th State Senate District on Manhattan's West Side, running from Christopher Street to West 103rd. He has championed progressive reforms on a wide range of issues, including housing, transportation, public education, LGBTQ rights, the environment, seniors, and of course, mental health. We're excited to have him share more about a piece of legislation he has sponsored in the state Senate called the Student Suicide Prevention Act that is very core to the topic of today's event. Thank you again for being here, Senator. So without further ado, can you share with us some key components of your legislation and why it's needed?
Well, thank you, Jonathan, and thank you, NAMI, and everyone who's here, including those incredibly important resources like the Trevor Project, just to take one example. I'm State Senator Brad Hoylman-Sigal, and as was said, I represent the 47th District, which runs from Christopher Street to 103rd. Jonathan, you didn't add my tagline, which is the district runs from the gay bars to Zay bars. That's our T-shirt slogan, if you will. And I'm really, really honored to be here with NAMI and this panel on youth mental health. I mean, mental health is such a serious issue for policymakers and a serious issue for younger people in our communities. It's even more important for young people in the LGBTQ community. In 2022, the most recent data available, we lost over 1,700 New Yorkers to suicide. And believe it or not, New York has one of the lowest rates of suicide in any state, underscoring just how huge this problem is across the country. For kids, for children 10 to 19 years old, suicide is the second leading cause of death, right after guns. And from 2007 through 2021, suicide rates for Americans aged 10 to 24 rose 62%, according to the CDC. And that is truly heartbreaking. And we all know it doesn't have to be that way. We can bring these numbers down and save lives if we dedicate more resources and attention to the organizations that are represented here and policies that advocate for better mental health care. As was mentioned, I'm working on a bill getting passed in Albany called the Student Suicide Prevention Act. This bill would require the governing board or body of every local educational agency serving students in grades 7 to 12 to adopt policies, procedures, and guidelines on suicide prevention, intervention, and postvention for students in these grades. And I really believe this legislation could make a major difference because we know schools play a critical role in suicide prevention and intervention efforts for youth in crisis. School-aged kids spend about 1/3 of their day in schools, giving teachers, administrators, and other staff the unique ability to provide a supportive environment. And when young people are in crisis, it's essential that adults around them be equipped to recognize issues and be able to respond appropriately. Our schools need the resources and contingency plans to address mental health so staff and students are able to help students in crisis and prevent the tragic loss of life. And that's exactly what the Suicide Prevention Act aims to do. Again, it would require school districts to adopt comprehensive policies on student suicide prevention, intervention, and support for those who are bereaved in tragic cases when a student takes their own life. These policies would equip school staff and students with the tools they need to assist students in crisis aged 7 to 12 and prevent suicide. And it would also call for the implementation of policies that specifically address the needs of high-risk groups, such as LGBTQ youth, youth experiencing homelessness, and those with mental health concerns and disabilities. Um, so, because we know that these same groups face higher risk for suicide than other students, and we cannot ignore that reality. Beyond this bill, I would add that there are other things that we've been doing in Albany to address this issue. In the state budget, we dedicated about $20 million for mental health services for school-aged children here in New York. That means hopefully more social workers, therapists, and resources for those who need them. We're also investing over $30 million to enhance mental health services, targeting first responders and aiding individuals with mental illnesses involved in the criminal justice system. So that means when someone's facing a mental health issue, is in crisis, a qualified mental health professional, rather than a police officer, would be able to show up to assist them. I'm also working on a bill to require schools in New York State to allow students to take mental health time off when they need it. Because, I think we all agree that mental health is real, even though it's not physically evident. It's important. And some days protecting your mental health is just as important as protecting your physical health elsewhere. But even more important than the work we're doing in Albany is the work that everyone here on the Zoom is doing to end the stigma surrounding mental health. It's true that for too long, many people have suffered with mental health silently, afraid of what others might think of them if they shared their story. But because of groups like the National Alliance on Mental Health Illness of New York City and all of you who showed up here tonight, young people are now beginning to understand that there is absolutely nothing wrong with having mental health problems. It's so normal. So many people go through similar struggles, and by talking about it in the open and celebrating our differences, we're making the world a better place and safer place for each other. So I can talk more about what we're doing in Albany, but I think the real value in an event like this is that we get to hear directly from you and all the resources you need and how you think I can be of help moving forward. So looking forward to hearing more about your stories and working together to improve the mental health resources for young New Yorkers. Thank you really so much for the opportunity to speak to you tonight.
Thank you, sir. No, we really appreciate that. And we really appreciate all the hard work that you're doing in Albany to address these very important issues. And, I'm thinking like, to me, this is a no-brainer, right? We need to make this happen. So I'm just curious, are there any challenges that you're facing or that you've like encountered that is making it difficult to get this done?
Well, Jonathan, a lot of what we do is about resources and resource allocation. And we start really in earnest in just a couple of months on the state budget. And that'll be, the roadmap for really the rest of the session? Will there be enough money committed to these issues, to organizations like yours and the others on this Zoom? That's number one. Number two, the big challenge, frankly, is the State Department of Education, which sets the curriculum for school districts across New York. And it's been difficult, I'm not going to lie, to get curriculum changes that the legislature has the power and authority to implement through the State Department of Education. They, in many ways, want to do their own curricula development, which I respect, but in some instances, and I would argue when it comes to mental health, they are a bit behind the curve. So I think those are the two challenges: resources and the bureaucracy. And there's a lot of good people at this bureaucracy, including the chancellor of the state education department, Betty Rosa, but it is its own beast. And as a legislator, I have to work with them to try to get bills like the one that I hope to implement, the Student Suicide Prevention Act, across the finish line.
Thank you for that. And yeah, that totally makes sense. Is there anything that we can do here that you have a captive audience that we can do to
Yeah.
help you get that legislation passed?
Well, I think we need to work together to support the legislation through an advocacy organization like yours and others. And I think I would hope that everyone on this Zoom would consider writing a letter or sending an email or making a telephone call to their state legislator on this bill. And I'll drop in the chat the bill number and how you can reference it if you would care to support it.
Awesome. Appreciate that. So we have our marching orders on that. We definitely want to help you get that done, Senator. As you said, as we know, this is very important. And, the beginning of hopefully trying to change a culture, right? Like a long, deep-seated culture where mental health was taboo and, no one afforded it the attention and the resources that it needs. So really thank you for that. I'm going to get my colleague Chloe involved into this conversation because now we've talked a little bit about the legislation, but I think it's important to also hear a little bit from folks who have, their own personal experiences. And, really thank you again, Chloe, for joining us this evening and, really being open to talk about your unique story. So, with really that said, can you share just a little bit about what that story is and your journey and, how you've been managing?
So I am lucky to have been put in therapy at a very young age when I started to show signs and symptoms of mental illness. My parents separated when I was around 11, and I started to very soon afterwards start to show very textbook signs of OCD and clinical anxiety. Um, I started therapy, just kind of basic psychotherapy for a while, and then also got involved in CBT, cognitive behavioral therapy, to target the specific behaviors that were kind of ruling my life at the time. But by the time I was in high school and I went to a very intense kind of pressure cooker New York City private school, I was kind of drowning in all of the upkeep that my mental health was warranting. I tried really hard with my rigorous workload to do all the things I needed to do to take care of myself on top of being on top of my work and my social obligations and all of that. And the stigma was still very real. I didn't want to tell my friends and my peers that I had to go to therapy twice a week after school. I would often make up lies or excuses of why I couldn't hang out or do something after school. And ultimately, my physical health suffered. I was typically showing up to school on 5 hours of sleep. The stress kind of wore on my face, and people knew that I was struggling, but I don't think they knew the extent to which I was struggling and where it was coming from, because it was pretty characteristic to be stressed with work at my school, but not as characteristic to elaborate on what was going on under the surface. So it was actually when there was a suicide attempt done on my campus that I decided to get involved with our guidance department and try and start a student-led initiative for mental health. At that point, like I said, I was lucky to have been in therapy for many years and kind of got a feel for what recovery looked like and how to integrate my mental health condition into my everyday life. And I wanted to kind of spread the wealth and feel like my peers could feel that way too, and also see that our guidance department and the resources that as a private school we were very privileged to have were being underutilized because of this notion that we were going to be seen as less worthy or less together, less deserving of the accolades at our school if we were to admit that we were experiencing these struggles. So that's kind of what got me in my realm of wanting to work in the space, advocate in the space, and what eventually led me to NAMI-NYC.
I appreciate that. And I know that for a fact, having been able to get to work with you, I know the organization is very lucky, and you really bring a certain experience that is very powerful. And I think just me hearing you talk, right? Like, I can honestly say that there are still things that I personally need to overcome when we talk about these matters. And so listening to your story and others is really empowering, and I think really helps to get folks to that place where it's like the senator was saying earlier, like, it's okay, we all deal with these things. And so it's very important to talk about it and to really do the things that's important for you to get to a place where you're feeling your best version of yourself. So, what types of support, I would ask, whether from fans or family or friends and organizations, that made the most difference in your experiences?
Yeah, I would say that as a rule of thumb, when trying to support a loved one living with a mental health condition, coming from a place of curiosity and really aiming to understand where your loved one is coming from so that you can understand their experience a little bit better, as opposed to a place of concern and panic and fear. That was the most effective for me when I felt like I had friends that just wanted to know a little bit more about what exactly I was grappling with, as opposed to being like, oh, she seems to be really struggling and I don't know how to help her. So I'm going to kind of just like take a step back, or I'm going to do the opposite and excessively check in and make it clear that I'm very anxious about the well-being of my friend. I think that actually had, when I did have friends or family members that took that approach, it actually had an opposite reaction where I closed off more. Whereas when I had people that intentionally checked in and led with curiosity and asked me questions and really just tried to meet me where I was at, that was where I found the most success and the most support. And I think that, as you said, Jonathan, it's really difficult when, I can't even begin to pretend I understand as I'm not a parent, but I think it's really difficult when thinking about these difficult topics in terms of also self-harm and suicide prevention. It's if you suspect that your child or your loved one or someone you care about might be in a headspace where that could be a potential outcome, it is the instinct to be over eager and to just try every which way to get to intervene in a way that can fix the problem. And I think that as kids or as young adults, we look to our parents to be a presence of steadiness and security, and the ones that should have this figured out, when obviously we're all still figuring it out as we go. But I think that when a child feels their parent shut down with fear, and approach an interaction or a conversation that's difficult with panic, they shut down and they don't want to disclose as much. And I just like speak from my own experience. Whenever I have sensed any fear in my parents, and shout out to my mom who's actually here right now, whenever I sense any iota of fear or even just any sense that I'm burdening them and that I'm impacting their mental health by having my mental health struggle, I shut down. I don't want to disclose anymore because I don't want to add to their load. And I also want to just feel like they know what to do and that they will tell me it's going to be okay. And sometimes they may not necessarily believe that, but what I would say is, like, to the best of your ability as a parent or as a caretaker, as a loved one, a friend, to the best that you are able to compartmentalize whatever you're feeling inside and what you're able to, provide that your loved one with, the better. Because being able to take yourself out of it, and to an extent your ego out of it, and really just be the person that they need, ends up going such a long way and builds a trust there that is really irreplicable. And I think that I feeling heard and feeling like I could trust that my parents or my family, my loved ones, weren't going to always sound the alarm whenever I was having a bad day, allowed me to trust that I could come to them in a harder time and be upfront and honest about what was going on with me, and that they would sit there in the trenches with me and meet me where I was at. So I would say that that's kind of my 2 cents on that.
Yes, thank you very much, Chloe. Really appreciate you sharing your story and your insights. Very powerful. Stick around. We'll definitely come back with more questions towards the end. I do want to bring the Trevor Project in because they do very important work for a very vulnerable population. So, Tommy, why don't you start us off and talk just a little bit about what the Trevor Project is for those folks who may not know, and the work that you're doing.
Yeah, thank you so much, Jonathan. My name is Tommy Marzella. I use he, him pronouns. And the Trevor Project is the leading suicide prevention and crisis intervention organization for LGBTQ plus young people. Trevor offers 24/7 services, connecting highly trained counselors with LGBTQ plus young people whenever they need support. Also, to drive prevention efforts, we operate other programs, robust programs in research, advocacy, education, and peer support. And so essentially we envision a world where all LGBTQ plus young people feel safe, they feel seen and accepted exactly as they are. You will certainly hear stats from my colleague, Dr. Matthews, tonight as well, but to kind of lead with a few, suicide is the second leading cause of death among young people ages 10 to 14, and the third leading cause of death among 15 to 24-year-olds in the United States. And LGBTQ plus young people are more than 4 times as likely to attempt suicide than their peers. The Trevor Project estimates that more than 1.8 million LGBTQ plus youth ages 13 to 24 seriously consider suicide each year. further, our research has also found that more than 80% of LGBTQ plus young people said it was important that a crisis line includes a focus on LGBTQ plus youth. So we have the 5 key programs that I've talked to you about. I'm going to just talk briefly about each one, but I think most people know us for our crisis services. So we operate 24/7 across the US and Mexico, and young people can reach us through call, chat, and text in the United States. Also, if a LGBTQ plus young person dials 988, Suicide and Crisis Lifeline, they may be routed to the Trevor Project's trained counselors as part of the 988 LGBTQ plus subnetwork. And so in Mexico, LGBTQ plus young people can contact us through our text and chat. In our fiscal year of FY24, which just ended at the end of July, so it goes from August to July, we fielded more than 450,000 calls, chats, and texts across the US and Mexico. So while many people know us for that part of our organization, we also have advocacy. So we work with state, local, and federal levels to advocate for legislation that protects the rights of LGBTQ plus young people. We're proud to say in 2024, we helped defeat more than 75% of anti-LGBTQ plus bills that were considered in states across the country. We have research. I'm going to allow Dr. Matthews to talk a little bit more about that when we do the pass off. But essentially our research team does regular evaluations and surveys to ensure our services reduce the risk of suicide and help us better understand mental health. The program I run is actually called Trevor Space. So that is a large social networking site for LGBTQ plus young people between the ages of 13 to 24. Really, the purpose of it is to bring people together so they can find peer support, peer advice, and make friends in a safe and moderated community. And then finally, the last bit is education to build allies for our community. So we educate adults who interact with young people to show competent suicide prevention, risk detection, and response. And our public training team has done, I think, more than 135 training sessions each year. And on the receiving end, we have about 6,000 plus trainees that we estimate we reach for best practices. So I know a lot there, but that is the high level overview of what the Trevor Project does.
Yeah, thank you very much, Tommy. And now you mentioned this research a couple of times, so I'm very curious, and I'm sure our audience is as well. What is some of that work that you've been doing, and what are some of the things that you're finding? Are you finding links between anything that you want to share with us?
That's a great question. So I think on my end, we're actually working a bit more to look at positive youth development. So positive youth development is something that is often done in a classroom setting. It is essentially how do young people develop in positive ways. And we're actually, as we're looking, and again, this is specific to the platform I run, which is Trevor Space, we're starting to see correlations between, essentially positive correlation between the strengths of positive youth development and 2 large outcomes, which are well-being and friendship. So what that effectively means is if we can understand well-being and we can understand friendship and we can start to put that into the platform in a way that is safe for young people, then we're really sort of on the right path. So a lot of what I'm focused on is how do we create a sense of community? How do we create positive values? And I think one thing that really stood out to the research for me is when we were engaging with young people, first, we give young people the survey, and then I think it's really important to, for my side of it, bring those young people in to start to better understand the research and the stats. So we hear, we have what they're saying, but then it's like, how do we understand it in a way that you presented it to us? And one thing that I think was really amazing to see was 99% of young people who were Trevor Space users who took this survey shared that they felt like it was important to help other people, and 97% strongly agree or disagree that they are developing respect for other people. So to me, it was just sort of highlighting the importance of how do we build these communities and the power of peer connection. And again, I'll let Dr. Matthews talk more about our other side of the research house.
Thank you. I appreciate that. So Dr. Matthews, I think without further ado, we'd love to hear some more of that, the work that you've been doing and, your takeaways.
Sounds good. And like all researchers, I couldn't help myself and I put together a few slides, but I'm gonna go through those pretty quickly. But I want us all just to have a sort of shared understanding. So I'm gonna share my screen really quickly. And so what I would like to do very, very quickly is do three things. One, kind of just give an overview of what we know, and then talk about kind of the work we're doing at Trevor to sort of really fill in those gaps that we don't know, and then really, again, hopefully spend the most time on just talking about how research can really lead to change and advocacy. And so briefly, we know that LGBTQ plus young people are at increased risk for both mental illness and suicide. So about 2/3 reported symptoms of anxiety, over half recent symptoms of depression. And then really what I want us to walk away with is that about 40% of the LGBTQ plus young people we surveyed said they had seriously considered attempting suicide in the last year, and 12% said they've attempted suicide in the last year, right? So these are, of course, really large, concerning numbers. That said, we do know a lot of things kind of, around this context. So, this is a very kind of busy graph, but what I want it to really show is, so, these kind of, the more people are accepting of sexual orientation and gender identity, we see lower rates of suicide attempts. And we also see that the more that folks have such a rejection of their sexual orientation and gender identity, we see higher rates of these suicide attempts. So this really has kind of two takeaways for me. One, the absence of rejection is not the same as kind of the presence of acceptance, right? So we need to really build a world where both of these things can kind of, we work to, remove rejection and also work to promote acceptance. And then also, it means that, we found that even the presence of one supportive adult in a young person's life lowered their odds of attempting suicide by 40%, right? So this is a big deal, and I think should be encouraging for all of us, the kind of role we could play in a young person's life. And we also know that mental health services are very, very important, right? Yet half of the folks we surveyed said they weren't able to receive that care. And the most common reason was that they were afraid to talk to somebody else about their mental health concerns, okay? But we do know that the folks who are accessing services are the ones who really need them. So for example, 75% of those who accessed a hotline or crisis service said they had considered suicide in the last year. And so, it just really speaks to the importance of having these sort of kind of critical acute services available for people. And we also know the role of communities is very important, right? So the more unaccepting a person said their community was, they had higher rates of attempting suicide, right? So folks who lived in very accepting communities had less than half the rate of suicide attempts in the last year than folks who lived in very accepting communities. And then finally, I want to make sure we acknowledge that, right, these things are not monolithic, right? So kind of your race and ethnicity, your sexuality, your age, your gender, identity, these things all kind of come together in really complex ways and give different pictures of how suicide and mental health look for LGBTQ plus young people. And so I just wanted to say, so we do our own survey every year, has over 18,000 people, which is what lets us generate this really wealth of information. Feel free to access it online at our website. And what I'm really proud of is that we have a really diverse sample, right? So we have a lot of diversity in terms of gender identity, age, ethnicity, sexual orientation, and the majority of our sample identifies as transgender or non-binary. And I'm also really excited is that we're kind of, not resting on our laurels. We're doing research in international context. We're doing longitudinal research. And so we're actually right in the middle of a study where we're following LGBTQ plus young people. And so they're telling us about their sort of experiences as they're happening. And we're really hoping that that will help us kind of do a lot more with getting our research translated into kind of helpful policies and practices. We're also really, for the first time, excited about, we're meeting with young people directly to inform our research. What should we be asking about that we aren't asking, that we're missing? And then we're also going to be releasing state-specific findings next year, right? So if you're interested in what's happening specifically in the state of New York, right, give us a few months and we'll be happy to share that with you. And again, I think for me, the real point of research is that we should be doing things that have actionable consequences, right? So for example, we know that LGBT plus young people who experience bullying are more than 3 times likely to attempt suicide than those who are not bullied, right? So that means, right, suicide prevention and kind of advocacy around bullying prevention are the same thing in that situation, right? And we also know that, for example, right, if you're a transgender or non-binary young person, right, living with people who respect your pronouns is a big deal. Like it almost halves the rate of suicide attempts. And so, I want us to really think about things like this as kind of mental health promotion, suicide prevention, because they are. And again, it's really important. I'm really proud that we work together with our advocacy team in tandem so that our research really gets out there in the hands of advocates and lawmakers. Because again, if it's just sitting in a journal somewhere, that's not really kind of the point, right? We want this to actually be useful and improve people's lives. And then I want to just very briefly acknowledge a recent study that came out because it's gotten a lot of media attention because it was the first study to provide a causal link between this kind of unfortunate, right, kind of just wave of anti-transgender legislation. And we found a direct causal link, and it actually increases the likelihood that transgender and non-binary young people will attempt suicide kind of following these things. So again, these are not simply abstract policies. The enactment of these policies directly, increases the risk of suicide for young people. And then lastly, I want to just point to science-informed resources. So we've worked with other organizations to help provide best practices around policies at the school level around suicide prevention and ways that are inclusive of all young people. And then we have on our own website kind of information about how you can create safer spaces in schools for LGBTQ plus young people as well. So I will stop there. I know that was drinking from a fire hose, but I wanted to make sure we can let folks know all the cool stuff we're doing.
Thank you, Dr. Matthews. Yeah, and again, if anyone has any questions on any of those things, jot them down, drop them in the chat. We're going to make some time at the end to try and get as many of those questions answered. So you talked a little bit about policy and legislation. From your perspective, how important is legislative action like the bill being sponsored by Senator Hoylman-Sigal in providing a safety net for vulnerable LGBTQ plus youth?
I mean, I think it's the only kind of, at the end of the day, a really effective way to kind of address suicide prevention. I think we have to think about this kind of from a public health perspective, and prevention is really kind of the only, at the end of the day, the thing that is going to really help us get out of this epidemic of kind of mental health and suicide among LGBTQ plus young people, especially. I think in just having a presence in the schools, especially, and kind of providing those resources there. So again, we just know that's so important. We know from our research actually that about half of folks said they had an anti-bullying kind of policy in place, but only 20% said it actually mentioned kind of LGBTQ plus people specifically. But we know you need that piece for it to really actually be effective in reducing suicide rates. So I think, legislation like this is really kind of the name of the game if we're serious about this topic.
Thank you for sharing that. When we talk a little about resources, I want to bring my colleague Patty into the discussion. So I think some folks know about NAMI-NYC, the work we're doing, but specifically, Patty, what resources does NAMI-NYC offer to adolescents and their families, and how do you ensure that these resources are accessible to the diverse communities like we're talking about, like the LGBTQ community, the Black community, and all other vulnerable populations?
Thank you, Jonathan. I'm going to try to be as concise as possible, but I have a lot of resources that I want to share. So First, I want to start with our free and in-person Ending the Silence program. And with each Ending the Silence, we talk with adolescents in middle school and in high school about mental health, the warning signs that someone may be struggling with their mental health, resources that are available to help, and ways that we can all strengthen our mental health, like, for example, getting enough sleep. The Ending the Silence program also has presentations for parents and for faculty and staff that work with adolescents. And the 3 presentations are designed to increase communication between these 3 groups, between young people, their families, and the faculty and staff that work with them, so that they can all better support the mental health of the young person. ETS or Ending the Silence is unique in that we give most of our student presentations in person, and that increases our effectiveness tremendously. I started coordinating Ending the Silence right when the pandemic era virtual presentations were being phased out and we were getting back into the schools. So I witnessed firsthand the striking improvement in connection with the students, especially with the students, and with all of our audiences, but especially with the students when we were in person. So I think it's an especially important attribute of Ending the Silence when loneliness and lack of real life engagement is negatively affecting all of us. Another unique feature of Ending the Silence that is that we have presenters with lived experience with mental health conditions. And we share our stories and with the audiences. We are not mental health experts. We're not clinicians. And what we do is share our stories. And that helps us connect with audiences through our lived experiences. This connection immediately lets the audience know that we are personally invested and that we care. And because of this, we often get impressive student engagement, even when students are very new to talking about mental health. In addition to Ending the Silence, NAMI-NYC has a new resource that we've just created, which is a resource guide for young people, and it's specific for the New York City metro area. In the past 2 years, I've spent a good amount of time in schools and learning about the needs of the communities that we serve. To address these needs, especially in our most under-resourced schools, we created an easily accessible resource guide entitled Mental Health in Young People, a New York City guide, and I will share these in the chat a little bit later. This guide is for anyone looking for mental health resources for young people, and it includes learn and get support subsections that for important topics such as bullying and suicide. And the guide includes New York City Metro specific resources. We ask that when I put the link in the chat, you'll notice that it will ask you to sign up for our NAMI-NYC mailing list in order to access the guide. And I really hope you sign up for the mailing list and you access that guide. And that really helps with our engagement and growing that program and supporting that work. NAMI National also has a resource guide that ours complements, and I'll share the link to both of those in the chat. Another resource that we offer to families is our fabulous helpline. Our helpline can talk with anyone 18 or older, and a live person answers the phone, and that is so rare today. I often tell families when I'm out in the community that the interaction feels like a warm hug. NAMI National also has a helpline that can talk with teens and young people. We also offer classes such as basics, and we actually have a basics class starting November 18th. The basics class is for parents of young people when the young person is experiencing emotional behavioral challenges. We have support groups and our family match program. So I would suggest to any parents on the Zoom tonight, if you are a do-it-yourselfer, check out our website or NAMI National's website. There are a lot of resources there. If you want an assist, contact our helpline. And if you contact our helpline, please let your responder know that you heard how wonderful they are, because they really deserve some praise. You also asked how we ensure that these resources are available to diverse communities. And I think probably the most important answer to that is that our Ending the Silence program and all of our resources are offered free of charge to the community. Our Ending the Silence program, in our parent presentations, we offer those either in person or virtually. We often give presentations in the evening and on weekends to help accommodate the schedules of working parents. We also have a Spanish language Ending the Silence presentation and resources for students. And NAMI-NYC just finished creating a Spanish language emotional and mental wellness presentation for parents entitled Hablemos, which means let's chat in English. And we are really proud of the community collaboration and the focus on cultural sensitivity that went into the creation of that presentation. After saying all of that, I still probably missed some of the resources that we offer. So please contact our helpline if you have any questions.
Thank you so much, Patty. A wealth of resources. We really hope that folks avail themselves of it here at the Trevor Project, at the Samaritans, anywhere that you can really get the information that your loved one or your child or whomever really might need. What other ways? I think because those were a lot of great resources, but what other ways can families help children strengthen their mental health?
Thank you for asking that. So I'm the parent of 3 young adult children, and through this, working with NAMI-NYC and coordinating our Ending the Silence program, I've really learned that parents and caregivers do not have to be mental health professionals to help their children. We can do a lot by listening and role modeling and communicating. And these are some of the topics that we cover in our presentations. One way that we can really help our children with their mental health is to care for our own mental health. And some of you may be thinking, I do not have time to focus on my own mental health. And I get that, but our children are watching what we do and how we treat ourselves. So role modeling, getting 7 to 9 hours of sleep at night, engaging in activities that we enjoy, like reading or baking or talking with a friend or playing sports. All those things help our children discover what they enjoy doing and what helps their mental health. So, and finding things that we enjoy doing will help our children. So, for example, my children like to cook with me, and we have great conversations when we're cooking together. I have one child who's had a lot of struggles with their mental health, and she really enjoys going for walks together because the problems are out in front of us. They're not between us, right? So we're not face to face with her problems in between us. They're out there and we're together facing those problems. So going for walks in nature really help us have those conversations. Another way to help our children with their mental health is to listen to them and listen to hear and understand rather than to solve or fix. And that is really, really challenging as a parent. And I often feel like my natural parenting instinct is to fix things, make everything okay, and keep everyone moving forward. But that instinct leads me to listen to respond and not to understand. So it takes work to do that. It's a practice. If my child shares a concern about something that is bothering them, and I respond with, "You'll be fine," or "toughen up," or "I had it so much worse," or we don't talk about that, keep it to yourself or get over it, then I may be missing an opportunity for my child to open up and process difficult feelings. So students often tell us that their parents do not think mental health is real, or that our advice to talk with a parent is not helpful. And so it is really important to listen to our children, to try and hear and understand them and fight that parenting urge to deny that there is a problem. A third way to really help our children that we discuss in Ending the Silence is to increase communication with your child's school and the people who spend a lot of time with them. This is one thing I wish I had done sooner with my own child. When she was struggling with her mental health in high school, her father and I noticed concerning changes in her behavior at home, and we didn't ask her teachers or coaches or friends if they were noticing anything different. And it took many challenging months and her condition getting worse for us to figure out the source of the problem and get her the help she needed. Once she was getting help, we talked with her teachers and coaches and found out that they had noticed behavior changes that concern them as well. And I often think about that. If we had thought to talk with the teachers and maybe her friends sooner, maybe she wouldn't have struggled for so long or so much. So increasing communication is really important. The second part of your question, how to seek help if your child is struggling with their mental health. Our program of Ending the Silence suggests talking with your child first. Find out what's going on with them. Like I said, listening to hear and understand, and engage them in the process of seeking help and choosing a time to talk with them that works for them. That may be according to the parent schedule, but the child's schedule. Maybe when they walk in the door after school is not the best time, but maybe it is. It depends on your child, right? And talk with school faculty and staff that engage with your child. Every school should have a social worker on staff at this point, and they would be a great person to talk with about your concerns, and try to engage your child in that conversation as well. We're going to share hotlines and warm lines and resources and guides and other community-based organization. NAMI's helplines and warm lines. NAMI's helplines are warm lines. Samaritans, the Trevor Project, the crisis text line 988. Those are all hotlines available 24 hours a day, 7 days a week. And we share those resources when we present with students and with parents. And it's such an honor to be part of this panel with the Trevor Project, because I excitedly share your resource with every presentation. It's in every presentation we give. So it's really an honor to be on here with you guys. Communicate. So if a higher level of care is needed, really seeking recommendations and engaging your child in that process as much as possible. The sooner we address mental health challenges, the sooner we can get back to feeling better and fully living our lives. And when presenting, I often use the analogy of having a sliver in your finger. It's a pretty simple analogy, but if we leave that sliver in our finger, it can just really take all of our focus, and it can fester or get infected or really bother us until we get that out. And that's a very simple way to look at this, that we want to address these struggles as soon as possible. When we do, we realize that mental health challenges are so common, and that there are other people out there that are going through very similar experiences. There are people out there that care, there are resources to help, and we can, it's so helpful to share when we're struggling as soon as possible. So that's one message that we really share with families. and with young people.
Thank you, Patty. That was very powerful and, you know, a lot to unpack, but that's real information and a lot of things you're saying. I'm just thinking of what Chloe was saying earlier and how, like, you know, that synergy, right? Because what you're saying that parents should do is exactly what Chloe's saying she needs, you know, her folks do and vice versa, right? And how you have those conversations to be productive. Because I can tell you, you know, I come from one of those households where I was told to suck it up, right? I'm told I'm not to cry, I'm not to show emotion, right? That's not what a guy is supposed to do. And so, you know, again, we don't have enough time to really dive deeper into a lot of those things, but you know, very powerful stuff. And so I'll have one last question for you. So how can community organizations partner with schools to foster a culture of mental health awareness and prevention of bullying and suicide?
Thank you. You know, I have found in our experience that working with schools, social workers is a really great way for community-based organizations, community organizations to get into schools. And in New York, I think it's in New York City, I think it's very school specific in terms of the resources that they offer. Some schools have mental health clinics, some don't. All schools should have a social worker at this point. And I think really starting there, starting with the social worker in this school or a parent coordinator, if you want to get in to talk to the parents, all schools have a parent coordinator too. So other people some of the people in attendance tonight might have suggestions as well. And I think that would be really valuable, or Tommy or Dr. Matthews might have suggestions as well. But that, I feel like that's really what's helped with us.
Wonderful. And Tommy, Dr. Matthews, is there anything you wanted to add to that, or maybe share some best practices for schools and communities to create more safer, inclusive environments, specifically for LGBTQ students who know are at higher risk?
I'm happy to talk a little bit and then I can pass it over to you, Dr. Matthews. I think, you know, a lot of the things that have been mentioned on here, you know, some of the things that pop to mind right away are using the right pronouns, right? Like using the correct names and pronouns for the young people that we serve. I know that comes up a lot in our research. Being welcoming, just simply being kind to, you know, young people, their friends, their partners, supporting gender expression. So, you know, whether that's through clothing, hairstyles, behavior. I think one great thing that everyone is doing tonight is you're taking time out of wherever you're coming from to gather to learn more and educate yourself. That's hard, right? I mean, it can be hard when you work a full day, you have a lot going on, and maybe you're tired, but taking the time here to learn more about the people, the issues, and the research. I guess I'll kind of think about, I mean, one other thing I want to say is just sort of being open to talking. That has sort of come up in a few different ways, but having those regular, non-stressful conversations with young people. I think a lot about, you know, how households can vary so much and what is acceptable or not acceptable conversation. And so, you know, sort of leading, I am not a parent, so I think it is hard for me to make that claim, but sort of leading with that empathy, that curiosity that was mentioned on the calls. Just, you know, for me, it's about listening to what other people are saying that is working and sort of leading by that example. Dr. Matthews, is there anything else you wanted to add?
Yeah, no, I mean, I think everyone has said a lot of great ideas, and I'm also not a parent, but my youngest brother is a teacher, and so, you know, one of the things that we often talk about is, you know, he says there's often like a willingness to kind of do good, but just like a lack of tangible resources. And so I'm going to drop in the chat right now a resource we have, and it's not some like crazy 30-page document. It's like really really short, and it just has a lot of little kind of practical things you can do. And again, I think thinking about this through the lens of if you're an LGBTQ plus young person, like having, again, just even one supportive adult who affirms your identity could literally, like, you know, save your life. And so I think, you know, thinking about it that way and understanding that everyone in a school environment can kind of play a positive role, I think is empowering, and hopefully, you know, makes people feel that they too can have agency in helping.
Thank you, I appreciate that. And before we get to general questions that I'll ask folks if they want to take it, and then we get to the audience, one last question for Chloe. What advice would you give to other young people who might feel isolated or otherwise feel in being in that same situation that you found? How would you tell them where to turn for help?
Yeah. It's interesting because I think back to when I was in that place and what helped me start to see a little bit clearer. And I think I have this like very distinct memory of when I was at recess, literally in 5th grade, and I told one of my best friends that I was going to therapy once a week instead of the dentist or whatever excuse I had been giving at the time because I had to ride a different bus. And they immediately looked at me and said, "I've been going too." And I remember feeling like, okay, so now if I just lead with authenticity and just kind of speak about my life experiences and be upfront, like maybe I'll realize that I'm less unique than I think I am. And I mean that not in a self-deprecating way. I mean it in the sense that like there's a ripple effect once we start to share with others. So I would say first act of bravery is telling a friend, telling a peer, just like, hey, this is what I'm going through right now. This is where I'm at. I'm not super sure what my next steps are, and I'm not really sure that there's anything you can even do to support me right now, or if there is, I'm not sure what it is, but I just wanted to tell somebody, and that visibility can go a really long way. And you will start to see that there are more people than you could imagine that relate to your experience. And I learned that firsthand too. When I was a senior, I spoke to my high school and shared my story in a similar way that the Ending the Silence program at NAMI-NYC does. And, you know, many of my peers and students that I'd never spoken to came up to me afterwards saying like, hey, I had OCD too as a kid, or I was going to CBT, I didn't tell anybody, blah, 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 blah. And I think that to me, it was just so sad that we had all been experiencing things that we could have helped each other with if we had been a little bit more trusting of each other's ability to receive that. So that would be my first go-to. And then if you hopefully have a positive experience, then maybe taking it one step further and telling a trusted adult, and looking into what programs and services your school or other local community organizations have for you, a lot that are free of charge. My guidance counselor suite at my high school ended up being my stomping grounds. People knew I was coming in and out of there every single day. I had no shame about it. I was like, this is where I take a load off at the end of the day. And it was such an underutilized space. And I'm coming from a private school where we were lucky enough to have multiple counselors that were trained and really, really well equipped to help us, and it was still being underutilized because of stigma. So I would say really taking a second to look into what resources are at your disposal, and if there aren't many, thinking about how you can bring those in through community organizing and reaching out to organizations like NAMI or like the Trevor Project, seeing if you can potentially have an affiliate at your school or organize a chapter or do a wellness fair. And I think just like the little things go a long way, because it's really in those moments where you're tabling and someone comes up to the table and asks, oh, what is this about? That they're able to feel seen and heard by the messaging that's coming across through these materials and resources. So that's my thinking on it.
Thank you very much, Chloe. That's great advice. Before we go to any questions that the audience may have, and hopefully there are a few, I think we'd be remiss if we did not bring up the 800-pound elephant in the room of social media, right? And its effect. So this is for everybody, anyone who wants to take a stab at the question. But tell me, how has the rise of social media changed the landscape of bullying, and what steps can be taken to address cyberbullying more effectively?
I mean, I'm happy to speak on it, but I just feel like I spoke a lot. So does anyone else want to jump in? No. I'm happy to speak on this just because I'm like in this unique age group where I didn't fully grow up with social media, but by the time I was in high school, it was very present, and college was the way of the world. Yeah, I think there's obviously still so much more research and awareness that needs to be drawn towards how harmful it is for all of us and our mental health. I think that something that is super important for parents, or that I would say feels good as the child or the young person, is having parents recognize that we're up against challenges that they never were, and that you hear a lot you hear the word unprecedented a lot in the last 4 or 5 years. There's been unprecedented times, and it's kind of like almost like the fatigue from that of not only, did we have this once in a lifetime pandemic and all of the things that have followed, but even just growing up in the age of social media and this digital age where everything is at your fingertips, and being anonymous and harassing people is just as easy as Googling. Like it's all at your fingertips, and I think that in of itself is unprecedented, and there's not enough awareness and conversation around that yet. So I think your question was how does it impact, or what was that your question?
Yeah, and you answered it. I really appreciate that, right? Because I think you got to the core of it, which is like the anonymity, right? Like
Yeah.
you no longer need to confront somebody in person, right? And like
Yes.
physically bully somebody. But now you just, with your fingertips, you can do that, probably even more damage, and you can do it from miles away, whatever the case is. So that was really good insight. And it's look, I tell you, it's social media for me. My not was it MySpace? Yeah, that was like the big thing. So I like, this is dating myself. I'm a little older than I might look for the folks at home, but I can relate with, not really growing up with social media, having my first cell phone when I was like pretty much in college, although, a few other people had theirs before, but really, that what social media has done to change it, and again, as everything you just said, it's really I think changed the game in terms of how folks are interacting and what they're doing. And of course there can be positives, but unfortunately a lot of times there are these negatives, and there are these bullying, and too much times we've seen tragic consequences that have come from folks ganging up, or unfollowing, a mass unfollowing and isolating them and so forth. So it really is, you know, a new dynamic, and appreciate that perspective.
Jonathan, can I add a few quick thoughts as well?
Please, Tommy, go ahead.
Yeah, so I lead an online community for LGBTQ young people. So, and thank you, Chloe, for taking that. I was gathering my thoughts in that moment of silence there. So, you know, really, I think it starts with, like many things, policy. So as you are crafting your policies, what do you want your community to be? What is acceptable? And then it's about getting users to understand that through behavior, right? So on our side, there's a team of moderators working when content gets flagged to us. So that's one piece. I think the second is technology is evolving so rapidly, and there are so many good ways that technology can be used. Some of those ways are proactive harm detection. So are there pieces of content that young people are uploading that can either be quarantined, or the system immediately flags this is a harmful piece of content, maybe a harmful picture, or something that can go to moderator review. So the way that we start to think of this and all of the vendors out there doing this great work to try to make the world a bit safer. And then I think finally, one thing that's just so important is, you know, policies are great, and trying to use proactive harm detection models are great. I think one of the best things you can do is just have conversations with young people and talk to them about online safety, right? There will likely be a moment where they come across something online that, you know, maybe they're in a situation or they're seeing something that's causing suspicion. Really, it's that educational component. Like, don't share, you know, information like your address or personal information, right? As the internet evolves, I mean, I think of my own iPhone, right? If I send a picture to someone else, it just automatically includes my location unless I proactively turn that off, right? So there's it's called EXIF data, EXIF. And so these things are challenges that come with you know, as technology evolves, and sometimes it's really hard to keep up with it. So if someone's uploading a picture to the internet, right, like you can there are platforms or tools you can have that will remove that data proactively. So if a user doesn't know that, it's like, okay, great. If you upload a picture, we can, you know, remove that data. But you know, we're just one platform, right? Like there's platforms everywhere. There's text messaging. There's all kinds of stuff, and I think it's important to sort of have that three-pronged approach of policy, tools that help prevent harm, and then making sure that you're talking to the young people in your life about you know the all elements of online safety, really.
Thank you, Tommy. Appreciate that. Okay, so why don't we have about 13 minutes left. Are there any questions from the audience for our panelists? I don't think I saw any in the chat, but if you were holding on to your questions, which is one of the things I've suggested earlier too, now is the time to drop it. And let's see. Okay, so we don't have any questions. If you have any questions, begin to formalize them. Maybe I'll throw one more out to our panelists and see if there's anyone who wants to take this. So, does anyone have, or can anyone share any success stories where proactive anti-bullying measures or mental health interventions made a significant difference in the life of the person you served, whether it be a family member, a client of the organization, or anything like that you'd want to share?
I can share a few real quick. I mean, I think so, you know, going back to the platform I was just talking about, Trevor Space, it's a place where young people can connect. And we didn't talk about this too much on tonight's call, but I think about this model. It's the social ecological model for suicide prevention. And it's basically like it starts with society, works down to community and individual and relationships, right? And so when young people are connecting, when they're finding that peer support, sometimes they're in communities where they don't have access to an affirming home or an affirming, you know, LGBT center or school. And so the only place that they're going to get that is in an online space. And there's this one quote that always stands out to me, and I just want to read it. It's on my screen. It's reassuring to know that there's so many queer people out there and that we share experiences. So it's not just me anymore. It's hard to explain, but it's really cool that so many queer people exist. And so, you know, we receive sort of these testimonials or these young people talking about their experiences. And sometimes it's, you know, I live in a small town. I don't have access to a car. This is the only place I can find community. And so it's really special to read that in a time when, you know, many social media sites are being critiqued for you know, maybe being harmful to young people, but we're seeing from our research for this community that we're serving so much of the opposite, which is it's bringing people together and it's providing that community that they wouldn't have otherwise.
Thanks for that. And Patty, I think you wanted to add to that as well.
I would like to answer the question that came into the chat. Because I was going to speak on that, but I
No,
really
please go ahead. We got a
Skylar-
question in the chat.
Skylar Rosen's question, what would you say to someone who believes raising awareness about suicide is actually giving people more ideas, putting the idea of suicide in people's head? I've heard this thought a few times. Absolutely. Yes, that is definitely a thought, a misconception that's out there. And when, so in our presentations, we briefly talk about suicide because our presentation with Ending the Silence is really a conversation starter and getting people more comfortable with the topic. So getting people to feel more comfortable having these conversations. And so we briefly talk about suicide and the reason, and some schools, you know, we have to have a conversation beforehand before they're okay with that. The reason we bring it in, with just a couple slides, is because when young people are struggling, we want them to know it's okay to talk about it. And when young people are having thoughts of suicide, they need to know it's okay to talk about it. It's not so bad that we can't have this conversation, right? If we stigmatize even having these conversations, then young people are going to be so afraid to share when they're struggling or having thoughts of suicide. And so having the conversation is really powerful. Another thing that we talk about is that it's helpful to even ask someone that we're worried about if they're thinking about suicide or thinking about harming themselves. And we ask the students, you know, why do you think that could actually reduce the likelihood that someone will try to harm themselves or kill themselves? And they know the answer. The person feels seen. Somebody cared enough to ask. It made it real. You know, those are the types of things that having these conversations brings out. And so I think that's what we've witnessed in the classrooms, and that's, you know, that's how I really believe that it's important to have the conversation and that you're not putting ideas in anyone's head.
Yeah, if I can just jump in here too, because I am NAMI-NYC's peer support groups coordinator, I want to do a little shameless plug for one of our peer support groups, which is called the Living with Thoughts of Suicide group. And we very intentionally have called it Living with Thoughts of Suicide, with the understanding that you can live with these thoughts and you can live, you know, hopefully not, but you can live your entire life with these thoughts, and they might just be in a long life. And they might just be a part of your experience. And I think that I'm really glad that Skylar asked that question because it's such an important myth to debunk, and a myth that actually really prevents people from getting help and unfortunately costs people's lives. Because this myth that there might be this contagion or like this ripple effect is not only false, but it's really harmful. And statistically isn't true. To Patty's point about just feeling seen, feeling cared for when someone has the care and consideration to ask is really real. And also just the ability to express, I'm having these thoughts and I'm not happy that they're there, but I want a space to talk about them. When we started this group, it was kind of a risky endeavor. Like we weren't sure quite honestly that our upper level administration of the org was going to be totally fine with it, because we're not a suicide prevention organization. We're an organization that talks about mental illness and mental health, but our focus is not suicide prevention. But starting this group, when we hit that 1 year mark of it existing and meeting every couple weeks, our group facilitators had this really sweet idea where they had wanted to make shirts that said 1 year and we're still here. Because this powerful sentiment of like, we've talked about our suicidal thoughts for an entire year weekly, and no one here has had the instinct through conversation that now it's more of an idea that they want to pursue, if that makes sense. That there isn't this ripple effect, that's a myth, that actually having this space to talk about their suicidal thoughts was suicide prevention in of itself. So I just wanted to highlight that because that's a really special space that we offer here.
Yeah, thank you for sharing that, Chloe, and thank you guys for that response. We had a question from Athena that Tommy addressed, but I'll just read it out. In line with the effect that policy can have on youth mental health, do you have any thoughts on the upcoming election and how to proactively combat potential mental health decline in younger groups depending on political results? Tommy, you want to read out what you got there?
Yeah, so essentially I just shared out a blog that we had that was created by our team focusing on how to support LGBTQ young people ahead of the 2024 election. While it is, geared towards LGBTQ plus young people, I think that a lot of the tips sort of throughout are apply to everyone, right? And so I think it's an important thing to think about. I'm thinking about my own mental health and wellness going into the election as well, as I'm sure many of us are. I don't have anything, I guess, major to say on this one. I think I think that just also keeping track of time. It's probably a good blog to read when you have a moment. I did want to say, if I have a second, one of the things I just on the last conversation, when I went through our suicide, our counselor training here, when I was going through that training, there was a slide. Part of the risk assessment is the first question is, are you thinking of killing yourself? And I just remember hearing that the very first time as part of that training and thinking what a jarring question that is. And I had the exact same thought that Skylar had. And as I learned more about it, that, I think they specifically said there's no correlation to, asking that question to increasing suicide. It's rather that you're assessing someone's, where they are, and starting to learn more about suicide as a spectrum from low, medium, high, imminent risk to not suicidal at all, all the way to a plan, means, and a time frame within a number of hours to just passive thought. So I just wanted to sort of comment to that I think that question is something that every advocate should practice saying, should think about. And just it is such a powerful question, and one that can be so jarring if you don't come from this world.
Hi, please.
Thank you for bringing that up, Tommy. And I think, yeah, it was very well said. I agree. One thing that it kind of brings me back to what Chloe said early on in the discussion is that as parents, our response to these conversations can really affect whether a young person's willing to talk to us about these things. And so if we have a panicked response, then they're less likely to reach out and talk with us. There really are resources out there to help And having thoughts of suicide is common. So if parents can, think, like, educate themselves, but just realize that there are resources out there to help. We don't need to have a panicked response to that. I really felt that what Chloe shared was really valuable of, children kind of looking for us to kind of feel like we're in control. No, as parents, we really don't know what's going on all the time, right? So like we're the first time parents, just like children are first time children. So, but just kind of realizing that there are resources out there to help us, having the conversation with our child, giving them a brave space to talk about their struggles is so helpful. So, and letting them know we're there for them, whatever's going on. I think those really, really help. So I just wanted to add that as well.
Thank you very much, Patty, and really thank you all, Senator Hoylman-Sigal, Tommy, Dr. Matthews, Chloe, Patty. It's been a really, I think, deep and insightful conversation. This is a very important topic. I hope that the folks who joined us were able to take away some important things and really avail themselves of all the resources that were presented tonight. There is help. Don't be afraid to reach out. I think that is a very critical component of everything that we heard tonight. And to really, look for those signs, look out for one another, and look out for your young person, right? Like, just really. And I just love how Chloe said, like, sometimes you say things, you don't need an answer. And as a parent myself, I know that's the natural reaction. Like, I'm going to fix this. You have a problem, I'm going to deal with it. But, it's really to listen, right? And to just really avail yourself of those resources. And, there are so many things that we have to do. It's the legislation that we need, the policies that we need to get done, those, the community organizations that are here doing the really God's work in terms of reaching out to folks and bringing the resources to them. And I feel like conversations like this go a long way to highlighting those things. And so I really deeply appreciate you all making the time to come and to talk about this and to share the work and the resources that you each have and are doing with the folks who joined us tonight. So with that said, I wish you all a very good night. For the folks out there, definitely avail yourself of your resources. Use all of us as a resource. And really let's stay strong as a community to continue to deal with this very, very, very critical issue. So again, thank you all. And I really appreciate your time.